Hey there, good morning, welcome. Today is the 24th of March 2025, and as you know, every Monday we have Health on Traxx coming away. Today we are talking about preventive medicine, and we're talking about an overview with YBhg, Datin Dr. Haizlene Abdul Halim. Now, she's a family medicine consultant with UiTM Private Specialist Center. Now, preventive medicine in overview refers to a topic that provides a general understanding of the field of preventive medicine. Now, medicine falls into multiple categories, but the most that we know is preventive and curative. But today we're going to be talking more about preventive. Welcome to the studio, Datin. How are you today?
Thank you, KG. I'm well, thanks.
All right, Datin. So today we're going to be talking about preventive medicine. Now, we've heard about preventive maintenance for vehicles or even any electronics, but what is preventive medicine? What does it mean?
Okay. So what is preventive medicine? Yeah. So this is a crucial opening question because whenever we talk about medicine or healthcare, in the mind of the public, it's always about people being sick and then getting the medicine or the right treatment for the illness. Rarely the first thing that will come to the mind of the people is prevention. Mm-hmm. So preventive medicine is basically when we take measures, be it a change in lifestyle or taking certain medications with the aim of preventing illness in the future.
Mm-hmm. All right. So, of course, preventive medicine is not like a one method cures all. But now let's talk about how does preventive medicine actually differ from the common one, curative medicine? What's the difference?
Yeah. So, in modern medicine now, so our goal is basically quality healthcare, for individuals. So this includes two fundamental principles, which is curative medicine, which is appropriate treatment for any current illness, and then preventive care, which is basically an attempt or measures to prevent or reduce basically health problems in the near future. Yeah. So as I mentioned, curative medicine is about managing a patient or a person who already has the disease or health condition, whereas preventive medicine is the practice of, the old adage that prevention is better than cure.
We understand. So, like, for example, let's just take a very simple example. Like, for instance, if someone already has diabetes, then you give them insulin and all of those medicine. But for someone on the route there, you will instead suggest what are the things that they can do to make sure that they never reach that point at all.
Yes, that's right. So that's basically the idea. So especially with our current lifestyle now, it's very different from previous generations. Before this, the previous generations, as simple as physical activity, it's something that is a part of their daily routine.
That is true.
Walking, physical labor. Whereas for us, now we have to sort of schedule or think about physical activity. Why? Because, we drive, we sit for hours in the car, we sit for hours in our office chairs and things.
True.
We take the lift instead of the stairs, so, and even things like our diet now, previous generations, they ate proper food, whereas for us now, unfortunately, a lot of our food, we have way too many options.
And many of it is processed as well.
Yes, processed food, a lot of additional,
sugar,
salt, artificial coloring, salt. And on top of that, even with food in general, we have so many options that it then leads to other problems such as obesity.
Yeah, that is true.
Which causes then other health problems. So that's where we are at the moment, unfortunately.
Yeah. And since you started talking about food in the lineup to Raya, I can already see the amount that is coming, All right.
Yeah.
So, Datin, what are the main objectives, would you say, of preventive medicine in society? I mean, it's there are protocols and all of that. So what would be the main objectives?
Okay, so there are actually a lot of different parts to it in terms of prevention. So just to share for public knowledge, so there's the primary prevention, which means that we do certain things, certain measures, or take certain medications before the disease starts. So, for example, we do certain practice such as stopping smoking or, doing a change in lifestyle to reduce the risk of getting cardiovascular problems like a heart attack before, like in healthy populations. And then there's also secondary prevention. For example, in persons who are already diagnosed with medical problems, we manage them to make sure that they don't get further episodes or complications from that problem. So, for example, patients who already have diabetes, for example, so we want to make sure that we manage their sugar very tightly to make sure that they don't develop other complications such as eye problems, kidney problems, and so on. Or in those who already had heart attack or stroke, they are at high risk of getting a second heart attack or stroke. So we do secondary prevention measures basically to make sure that they don't get a second episode. So that's primary and secondary prevention. We also have what we call certain practice for special populations. So for example, in pregnant women, so we have like a specific prenatal care to make sure the health and safety of baby and mother, or preventive medicine in, for example, in elderly population. So certain geriatric care to make sure that they have good quality of life. And then, of course, another aspect of prevention is also vaccinations, as many know, whereby we give vaccines to immunize a person so that they don't get severe infections from those illnesses, from that specific illness. They may still get the illness, but it would be very mild.
Yes.
So that's the goal, basically.
Doctor, now this is a question from myself. Would you consider things like such as supplements and vitamins to be part of the preventive medicine ecosystem? Or do they fall under that category?
Okay. Yeah, I would say so. I would say so. It's just that in terms of giving advice, in terms of supplement and vitamins, just have to be a bit cautious because there are so many in the market that we do not know their safety profile.
Yeah, and a doctor doesn't advise you whether you truly need it or not.
I mean, because you can get those vitamins from food, you see. So that's the advice I always tell my patients. I mean, it's better if you spend your money on real food. People say vegetables or certain fruits are expensive, for example, but rather than spending on artificial vitamins whereby you can get it from proper food.
Vitamins are not cheap too sometimes. The ones that I've seen some go up to 300, 400 ringgit. Why would I need that when I can get it from food? All right.
Healthy food, that is.
That is true. No more sausages and burgers for me. All right. Datin, we're going to be taking a short break when I listen to one song. And once we come back, there is more that we're going to be talking about. We're going to be talking about some of the regular health screenings that one can do to prevent diseases, and also why should you manage risk factors. And for our listeners out there, we're currently on TikTok Live. If you would like to ask us questions, or if you are a student of Datin herself, you want to ask us questions, you can definitely do so. And that is via TikTok. But right now, let's get some music rolling. We will be back in about a few minutes. And I'm pretty sure this song is something that all of us know in the lineup to Raya. Here it is. Welcome back to Health on Tracks, and today we are talking about preventive medicine and overview. Young Berbahagia Datin Dr. Haizlene Abdul Halim is with us today. She's a family medicine consultant with the UiTM Private Specialist Center UPSC. Datin, and what types of regular health screenings do you recommend to prevent diseases?
Okay. Firstly, before we talk about the specific health screenings that are available, I just want to clarify that not all diseases can be screened. Okay, so there are certain principles in health screening. Disease progression. So firstly, we need to know, for any disease that we want to screen, we need to know the natural history of the disease or the disease progression. So that there is ample time for us to intervene. Okay, so that's when we can make an impact lah. Okay, and then we also need to have a suitable test for the disease. So something that is acceptable to the public, something that is non-invasive with good specificity for the disease. And then, there should also be an acceptable treatment for the disease that we screen. So there's no point in screening something that we are not able to provide treatment for. Okay,
It'll be like, hey, here's your disease. We can't do anything about it.
Yeah. And then, for like things like national or mass screening, there are other things such as cost effectiveness and things like that. So, in terms of what we would recommend, it really depends on your risk factors as well. What you want to be particularly, if there's anything in particular that you're worried of, for example, if there's any specific family history, okay. And then otherwise, things that is important, something that's important is, of course, the number one cause of mortality worldwide as well as in Malaysia, which is cardiovascular disease lah, ischemic heart disease. So the in terms of screening, right? So there are different intervals for different kind of screening, different diseases. So for example, for mammogram, the recommended interval is 2 yearly, every 2 years once you're above 40. And then for cardiovascular screening, so that would include things like screening for their risk factors, which is screening for hypertension, high blood pressure, diabetes, high sugar, and high cholesterol. Okay, so this can be done yearly if you're completely healthy and if the results come back as normal. But then let's say if you have additional risk factors or if let's say your results come back as borderline, the interval may be a bit shorter, like 6 months or so.
All right. So you would suggest getting like a full body checkup, like the ones that they do it in the clinic or even in the hospital. It's pertinent to keep yourself running healthily.
Okay. I would say it depends on yourself. Because sometimes doing like everything in one go in full, I mean, for certain people it can be quite costly. But if you can afford it and you can do it, by all means. Otherwise, you can do basic things first. Like I said, the cardiovascular screening, very simple, and it can actually save life because a lot of people, they have high blood pressure without even knowing because, it's completely silent. You don't have any symptoms and then suddenly you end up with a stroke. So it's something as simple as just checking your blood pressure. Yeah. So that would be my recommendation. If you have family history of certain cancers especially, then you may want to be a bit more careful in terms of that, and then the thing is about screening as well, you should know it's a continuous process. It means that it doesn't mean that if you've done the test once that you will be completely free of disease or that you will not get it in the future. It simply means that you don't have that particular condition at that point in time. So it is something that you would need to do, repeatedly. It's basically for early detection.
Okay. Doctor, another question from the top of my head. You did say this is a constant thing. You have to do it over time. Are there any tests of this sort that we can do at home, which is accessible, that there are tools available? Is there anything that you would suggest for people out there that they can do at home, that you think should be done at a very consistent basis?
the only thing that that's easy enough for the public to do on their own at home, I would say, is checking their blood pressure. Because that is very simple, it's not invasive.
Yeah, it's not.
Whereas other tests may require, things like taking a blood sample, for example. So they would need to go
To the hospital.
to the clinic. Yeah.
All right, understand. Yeah, I mean, blood pressure cuffs are easily available right now, and it's not that hard to read. Also, and also, children, help your parents if they need to. Yeah, don't just let them, have to check everything by their own. All right. So, you did mention risk factors such as obesity and high blood pressure. Why is it managing those is very important in preventive medicine?
Okay. So when we talk about blood pressure and obesity, right? So it's basically, we're talking about cardiovascular health, whereby, as I mentioned earlier, ischemic heart disease is still the number one cause of mortality. So there are actually many other risk factors that contribute to cardiovascular disease. So obesity, one of it, high blood pressure, diabetes, high cholesterol, and of course, don't forget smoking.
Yeah.
And then so we can group them into basically modifiable risk factors, such as this, or non-modifiable. So non-modifiable, basically there's nothing much you can do . Things like, with increasing age, your risk increases, so you cannot stop aging. And then family history, so you cannot change your genetics. But the other things I've mentioned, we consider it as modifiable. So if you don't have those problems yet, adopt a healthy lifestyle. If you're smoking, stop smoking, in order to reduce your risk of getting this in the future. If you already have diabetes, or if you already have hypertension or high cholesterol, it's fine. It's still modifiable, meaning that if you take the right medications, you do the lifestyle changes, and you're able to control your blood pressure, not to go above, and then we control your sugar not to go high, then it still reduces your risk.
All right. Okay, doctor, we're going to be taking another short break, and once we come back, there is more to talk about. Joining us today is YBhg Datin Dr. Haizlene Abdul Halim. She's a family medicine consultant, UiTM Private Specialist Center, UPSC. We're talking about preventive medicine. Don't go anywhere. If you do have questions, you can definitely ask them on our TikTok page, and we will be right back. Welcome back, and today we are talking about preventive medicine and overview on health on Traxx. Today joining us is Datin Dr. Haizlene Abdul Halim, family medicine consultant, UiTM private specialist center. Right, Datin, what can we do to help raise awareness about preventive medicine?
Okay, I think we do get more and more healthy individuals coming in for health screening. So that's really positive. But I think these tend to be individuals who are perhaps a bit more educated and more aware of the importance of health screening. What we are doing today, for example, having health talks over national radio. It's one of the many ways that we can do to raise awareness. Health education through national TV, social media, all are good outlets too. It's basically to make people understand the value and the importance of good health. Okay, but in order to really raise awareness, especially in about preventive medicine, and especially in rural areas where they may not have access to TV, or even they may have poor internet, they don't have social media, so this requires a different approach. So in these situations, usually what healthcare workers do is we conduct things like mobile health clinics, or we set up health carnivals at their place to give health talks, and at the same time we also offer free basic health screening and things like that. So these are some of the ways that we can do to raise awareness.
And my personal opinion, that I think should be part of the curriculum at school. I think children need to be educated more about health. There's a lot of adult world practices that they get introduced to very late, like for instance taxes and all that. And I think health practices should also come in early so that they are able to, and the hospital doesn't become like a scary place for them. It's like, I just go there to get healed up. It's not like I'm going to go there and the doctor's going to stab me with stuff, right? Things like that. But that is of course my personal opinion. Now Datin, before we end for today, could you just give us some examples of diseases that can be prevented via preventive medicine?
Okay. So I think as we've discussed before, there are several ways to look at this. So I think we've touched quite a bit on lifestyle changes. In terms of food, changes in diet alone can actually reduce a lot of various diseases. Reducing salt can help reduce the risk of hypertension. Reducing sugar intake can reduce the risk of developing diabetes. Eating healthy vegetables and fruits, and avoiding processed food can definitely reduce your risk of getting cancer. Lots, even things like as simple as drinking enough fluids can prevent simple things like mild dehydration, which a lot of people don't even notice. It's things like suddenly, you're always getting headaches, feel very tired. It could be something as simple as mild dehydration because you're not drinking enough. And then, of course, exercise also helps reduces all the things that we've talked about in hypertension, diabetes, heart attack, and so on. Don't forget the two culprits that's quite common in our community, unfortunately, which is cigarette smoking and alcohol. These two also can prevent a lot of diseases, smoking, direct link to cancer, and then, of course, specific lung conditions such as asthma, chronic obstructive pulmonary disease, and alcohol. Cutting down alcohol or even reducing alcohol can reduce your risk of developing liver failure and things, okay? So those are the lifestyle changes. And then there's also prevention through immunizations, which also I've touched on. So we've actually managed to eradicate smallpox, through a worldwide immunization program. And we've also, the whole world, we've actually also reduced significantly serious infections such as diphtheria, polio, through effective programs. So that's another example.
Preventive medicine has a really proven record going back hundreds of years. So you know what, I think today the topic has been very, very interesting, and also it reminds us, that you can do something about it even before it happens to you.
That's right.
So go ahead. If you haven't had a health checkup in a while, which that reminds me, time for mine. Before Raya, I need to go get mine done. So yes, and with that, before we end, Datin, anything else you would like to add for our listeners?
No, not. I mean, I think in a nutshell, it's just basically for us to be a bit more aware and make the commitment to take care of your health. It's simple things such as watching your food, walking a bit extra for the day. You may not have time to exercise, for example, but you can always walk a bit more. Taking the stairs instead of the lift and things like that. And of course, if you're smoking, stop smoking.
Yep, for all our smokers out there, please do stop smoking. And for those of you who think vaping is any better, no, it's not. Well, anyways, thank you so much, Datin. It's had an absolute pleasure having you here today. We hope to have you again. And before you go, I would just like to say Selamat Hari Raya to you. And I hope you have a great one.
Okay, thank you, KG. Hope what I shared has been beneficial to all. And Selamat Hari Raya to all the listeners too.
Thank you. And joining us today was YBhg Datin, Dr. Haizlene Abdul Halim, and she was a family medicine consultant, UiTM Private Specialist Center, UPSC, Preventive Medicine and Overview, right here on Traxx. We will be right back.